have the closed mechanical injuries. So these are things like, let me show you, contusions, also known as bruises, hematomas, which, okay, this is a very extreme example, but it's just when the blood vessel wall breaks, lymph extravasation, and hernias. Well, that's what I see so far, but we'll go one at a time. So a bruise doesn't just occur like this. It obviously has 4 stages. Like when you first hurt yourself, the bruise doesn't immediately appear. First, you'll see light changes of the skin and subcutaneous tissue. Maybe you'll feel more sensitive, for example. Then there may be a rupture of the subcutaneous tissue and the blood vessels underneath the skin, and what you'll get is something like a hematoma. It looks very similar to the next picture. Lymph extravasation, you'll feel some swelling, which is because of the trauma. But if there's more trauma, of course, more blood vessels will rupture. Maybe there'll be nerve damage. There'll be even total rupture of the muscle, and this leads to a hernia, but we won't get into that. And yeah, what you can get as well is total rupture of muscles, fractures of bones, and traumatic toxicosis, meaning like, yeah, I don't know. Anyway, so the next thing is a hematoma. I already mentioned this is when a blood vessel wall breaks. What you get is a local blood-filled swelling. And it can be spontaneous, but this is obviously traumatic. It's usually in an organ or a soft tissue place. So this is obviously a group of muscle where someone's been hurt. And it goes through its own stages known as resorption, arrangement, capsulation, petrification, aneurysm. 5. RACPA. Resorption, arrangement, capsulation, aneurysm. Okay. Lymph extravasation, it's harder to see, but you can see there's like a sort of white swelling under the tissue. This is when, you know, a lymph vessel has broken, and this causes a local swelling filled with lymph. And with a hernia, well, obviously that's more obvious, but the definition is when an organ like this protrudes through connective tissue or a cavity wall. In this case, it's sort of the abdominal wall. And yeah, what else is there to say? And hernias have different classifications. There's an inner hernia. These are usually diaphragmal and omental. So say a diaphragmatic hernia, you can't see it on the outside like an outer one. So, you know, I told you there are 2 types, outer and inner. So this outer one that we saw in the picture is clearly the abdominal type, but there are other types that you can see. With the inner type, diaphragmatic hernias, you can't see. You also need to look at how symmetrical they are, the swelling's form itself, its size. Where is it? So a contusion, for example, obviously a bruise can occur anywhere, but we mentioned it's more likely in soft tissue places. Hematomas, quite similar. Lymph extravasation can occur on the neck, near the knee and chest wall. So basically very bony areas, I'd say. You can see other things here, issues with walking. Consistency, so a bruise will feel quite soft and doughy. Well, okay, only a bruise will be described as doughy, so this is only doughy. Hernia, on the other hand, will be described as soft and doughy, but this is only with internal hernias, obviously. Now with a hematoma, it depends on the stage it's in, and with lymph extravasation, it can be undulating, wave-like emotional patterns. So basically, if you put pressure on it, it can actually move, which is kind of cool. So in terms of treatment, what do we do? Well, with prolapsed organs, let's say the vagina prolapses, obviously we can do a rectal exam. We can do an x-ray for internal and external hernias, and in the case of everything else, obviously puncturing them is forbidden. The best thing you can do is just leave them be, basically, even if they're really bad. I think the best thing to do would probably be to x-ray just to see if the damage is extensive.